All right. Well, I first want to thank you so much for joining us this evening for this COVID-19 vaccine forum. To introduce myself, I am Stephanie Quinu. I'm an investigative journalist with Spectrum News 13, and I will be your moderator tonight. And really, I want to say that this is going to be a candid conversation with our experts. It's going to be centered around connecting you with critical information about COVID-19 vaccines. And that being said, we have truly an incredible panel with us tonight, a wealth of knowledge, a wealth of perspective. I want to introduce them to you. So when I say your name, if you just wanted to raise your hand, I know that we have your name underneath. I want to start off with Orlando City Commissioner Bakari Burns, who is the Commissioner of District 6. And he is the one who spearheaded this forum. So Commissioner Burns, thank you for doing that.
My pleasure.
A little bit about Commissioner Burns. He was raised in Orlando, Florida, attended Florida A&M University, where he received a Bachelor of Science degree in healthcare management and a Master of Public Health with a concentration in health policy and management. Since 2003, Commissioner Burns has served as president and CEO of Orange Blossom Family Health. And then in 2019, that is when he was elected to commissioner for District 6 in the city of Orlando. We are also joined by Dr. Innocent Akujobi, who is an emergency medicine physician at Orlando Health, originally from St. Louis, Missouri. He went to undergrad and then medical school at Howard University in Washington, D.C. In his infrequent spare time, he enjoys spending time with family and friends, exercising and traveling. And Dr. Akujobi is also currently completing an administrative fellowship at Orlando Health. Dr. Ernest Paige II is also part of our panel tonight. Welcome, Dr. Paige. Dr. Paige is the Director of Administrative Services for the Florida Emergency Physicians of Team Health, which is an organization that provides staff of emergency physicians, physician's assistants, and nurse practitioners to all 17 Advent Health emergency departments in Central Florida. Dr. Paige also serves as president and chairman of the board for the Emergency Medicine Learning Resource Center and the Florida Emergency Medicine Foundation. And last but certainly not least, we are joined by Dr. Kirk Cadet, who speaks many languages, which is how he's able to connect with so many of his patients: English, Spanish, French, Creole, and sign language. Dr. Cadet earned his Master of Public Health at the University of South Florida and his medical degree at Nova Southeastern University, COM. He received his internal medicine training at Columbia Hospital in Florida and completed his infectious disease fellowship training at Orlando Health, and currently serves as Chief Medical Officer for Orange Blossom Family Health and actively engages the community regarding the COVID-19 vaccine. And the reason why I wanted to share these extensive bios is really to show you that there is a wealth of experience, a wealth of perspective and knowledge, and that is why we have the panel that we have tonight. Before I get to the question and answer portion of our forum, I want to turn it over to Commissioner Burns for some opening remarks.
All right, great. Thank you, Stephanie. So more than a year into the coronavirus pandemic, we may be finally seeing the light at the end of the tunnel. However, minority communities are among the hardest hit by COVID-19 pandemic in the United States, but have the lowest rates of vaccinations than other groups. The lower rates of vaccinations have been attributed to vaccine hesitancy that is often fueled by misinformation about the vaccine and its efficacy and safety, but also lack of trust in the government and healthcare institutions. And one that was brought to my attention most recently was the fear of deportation among undocumented immigrants. So we're here this evening to share some information and answer your questions about the vaccines and that are available with the hope of increasing vaccine confidence among many of our community members. So again, thank you for joining us this evening. And Stephanie, I'll turn it back over to you.
All right, Commissioner Burns, thank you so much. I do want to start with the biggest question I think is out there when it comes to people deciding whether to get the COVID-19 vaccine. And that question, of course, is, are these vaccines safe? Dr. Cadet, I wanted to pose that question to you. Are these vaccines safe?
Absolutely. According to the data, the study that they've done with Pfizer, um, it was proven that the vaccine for Pfizer is at 95% effective, but also very safe. When we say uh, safe, in terms of side effect, major side effect, very rare. You can have some simple side effects such as headache, malaise, a little bit of fever, and this is more reactogenicity, meaning that your immune system working. So you can say that the vaccine, they are Pfizer, effective and safe. Moderna, very same thing in terms of safety, side effect profile, headache, malaise, fatigue, a little bit of fever. Again, sign that your immune system is working. Um, but you don't get really major side effect that people are afraid of in terms of dying, for example. That would be pretty unusual.
Dr. Cadet, you bring up a really good point, and Dr. Akujobi, I want to bring you in on this. When it comes to safe, obviously, Dr. Cadet, you mentioned that there have been trials, but what's interesting, and I think maybe what people are so unsure of, is typically it takes years for clinical trials to come to fruition and for the FDA to approve vaccines. The FDA, of course, approving emergency use. So when these trials are condensed into such a short amount of time, Dr. Akujobi, how can people have confidence that these vaccines are safe?
So people can have confidence that these vaccines are safe. I would say let's take a step back. So COVID-19 is a novel virus. Okay, so we're currently in a pandemic with a novel virus in the sense that there have been studies and research done on coronavirus in general, but this new COVID-19, since it's so novel, that it takes time to kind of study it. And so with the fact that we have Pfizer and we have Moderna that have done clinical trials, although the clinical trials have been condensed, the clinical trial has actually still been conducted. And what the recent data has shown is that these clinical trials with both Pfizer and Moderna, both are 95% or around 95% effective at preventing individuals from getting severe illness. So illness that drives an individual to be hospitalized, illness that drives an individual to face mortality. And so before the Pfizer vaccine came out, there were studies done for anywhere from 6 to 12 months where a certain subset of patients received the vaccines, and we were able to watch and see how it kind of played itself out in these individuals. And the FDA was able to step in and say, hey, we have enough data to authorize emergency use, that these vaccines are safe enough to induce into society in order to prevent individuals from coming down with severe illness if they were to come in contact with COVID-19.
Okay. Oh, please continue.
So I would say that although, the clinical trials have been condensed, their safety and efficacy are still paramount before they actually come out and are induced into the society.
Dr. Paige, what's your perspective if people are thinking, gosh, it was only a few months before the FDA issued emergency approval, would they have not issued emergency approval had they not been safe? I mean, is that something that we can look towards?
But I think the important thing here is that there were thousands and thousands of people in each one of these trials, and there were no big red flags, no big side effects that actually presented themselves. And it's also important to note that the technology used to do this is really not new technology. It's been around for a while. It's been studied for a while, and so I think what also helped really kind of expedite this was that the government got behind it. The government pushed. A lot of the delay in vaccines coming out are, the companies have to spend billions of dollars trying to manufacture it and things of that nature. But the government came in and said, look, we'll help you figure this out. We have a pandemic. And so it was a special situation. And when they talk about 95, 94% efficacy, You don't really find that in a lot of vaccines. I mean, if you look at most of the vaccines, and I see Dr. Cadet shaking his head, when you look at most of the vaccines, I mean, you get 60, 70%. So when you find 90% after you've really put thousands and thousands of people through the trials, and you don't see any huge side effects or anything negative from the trials, and you're in a pandemic, you know, you have to look at it and say, we have something that's 95%, you know, with 95% efficacy. We can't really hold on to this, you know. We need something to help us out of this pandemic, and this vaccine is what's really gonna help us out of the pandemic. So it's not really new technology. You know, people think it is, but it's really not. It's been around for a while.
So Dr. Paige, you talked about, you know, the 90% efficacy. You know, I want to bring in another hot topic, you know, one that Commissioner Burns, I'm sure that you have heard a lot about, which is the Johnson & Johnson vaccine. You know, from your end, Commissioner Burns, is that been a big question that you've been hearing a lot about?
Yes, and actually, I do believe with the Johnson & Johnson pause, that took us back a little bit, because what happened, you know, we've been out educating our communities on the need to be vaccinated, and we've been working to increase the confidence. And then when Johnson & Johnson came on, it really turned into the preferred vaccine because it was one shot. You didn't have to come back and get another shot. And so what we did, we started getting those vaccines out. People's confidence, I believe, started to increase. But then when the pause came, I think it took us back a little bit. So, you know, we understand that the panel is meeting tomorrow, so we're anxiously awaiting their decision. But I do believe that the pause that we're experiencing with Johnson & Johnson will have some impact on communities and their confidence in the vaccine. But that's why it's imperative that we as healthcare professionals continue to stay out there, educate, share information, be transparent. And I think really one of the things that was a win for this entire process was that it was caught early. The government and Johnson & Johnson has been transparent. So I think we're taking steps to improve the trust in some of our institutions that are responsible for caring for us. And I think this was an example. So again, I think we just have to continue to educate our communities, but also let them know that while you may have a question about Johnson & Johnson, Pfizer and Moderna are proven to be safe. And so we want to continue to encourage them. Again, it might be an additional shot, but I'll take an additional shot and be fully vaccinated against this pandemic that is ravaging many of our communities.
Absolutely. So you mentioned the three, the Pfizer, the Moderna, and the Johnson & Johnson vaccine, which is currently on pause. You also mentioned, of course, that the panel is going to be holding their second emergency meeting tomorrow to discuss that pause for the Johnson & Johnson. Dr. Akujobi, I want to bring you in because right now the Pfizer and Moderna, those vaccines are still available. We don't know yet about the Johnson & Johnson. But just how effective are these? I know that Dr. Paige had mentioned the efficacy rates, but how effective? I mean, if you're thinking, gosh, weighing the pros and cons, right? Does it benefit me greatly to receive them? How much protection do these vaccines actually offer people?
So these vaccines are actually very, very effective. If we look at some of the data, so to date, there has been around 31 million cases of COVID-19 here in the United States. Over 216 million people have been vaccinated to date. And what the current data is showing is that our most vulnerable population, the population that we were initially seeing that had the highest mortality rates, that mortality rate has gone down because our efforts were primarily geared around vaccinating the people that are most vulnerable, the individuals that have hypertension, diabetes, cancer, lung disease. And so just seeing the mortality of just that subset, the patient population that was vaccinated, that was at the front line of vaccination efforts, just seeing that mortality rate decrease just speaks to the nature of the efficacy of the vaccine in itself. And so, you know, I'm fully behind the Pfizer and the Moderna, you know, their 95 and 94% effectivity rate in the sense that it is truly preventing individuals within society from getting severe illness, from having to be hospitalized, from having to die from COVID-19. I think that the vaccine is very, very effective.
Dr. Cadet, I want to get your perspective because Commissioner Burns was saying, the Johnson & Johnson became kind of that preferred because it was the one and done. Whenever, and we don't know necessarily when that might be, but when the committee decides to resume the Johnson & Johnson rollout, should people feel safe getting it once that happens?
Absolutely. All the previous studies, they were done in terms of being effective and being safe. Now, unfortunately, you have some rare side effects, which is 1 out of 1 million. About 6 people, possibly 7, where they had thrombotic and then thrombocytopenia as well. So now we have to realize that those side effects, they were among women between 18 and 48 years old. So I believe they're going to resume, but with some criteria. I think that meeting those criteria, I think that people should really face it. I would, because we're in the middle of a pandemic. We know that the vaccine works. There are occasional, like very rare side effects. With actually, with in fact, you can get this type of side effect. There was a possibility, looking at possibility where the adenovirus that is used, sometimes you can end up having antibodies that goes against platelets and causing low platelets. So you can have that, but that's very, very rare compared to so many cases of COVID that we have right now. So in medicine, it's all about risk versus benefits. I think that the benefits definitely outweigh the risk right now.
So Dr. Cadet, you mentioned that if the rollout were to resume, you would take the Johnson & Johnson vaccine. I want folks to see with our panel who are medical experts, you've had years of experience with, raising your hand, how many of you would feel comfortable taking the Johnson & Johnson vaccine if it were to resume? Okay. Which really indicates, I think, to our viewers that if a medical expert feels safe, that's a good indication. Dr. Paige, I was wondering if you had anything to add to that.
Absolutely. I mean, I think Dr. Cadet did a good overview of it. And I was going to say, and you kind of preempted me, that if Johnson & Johnson was the only one available to me, I would take it. I mean, you have to take what's available to you. Mm-hmm. And I do think that they will come out with some guidelines on who should get the vaccine and who should not get it. But when you look at it, when you're talking about 1 in a million, the Johnson & Johnson vaccine, and what everyone has to remember is that each one of these vaccines will potentially keep you out of the hospital, keep you out of the intensive care unit, right? And they will prevent serious illness, right? And that's what we're trying to do. That's when you get in trouble with COVID, when you get serious illness. It's really hard to recover from that. And being an emergency physician, I see it every day I work, and how COVID just kind of really ravages people, impacts people's lives. And if you can stay out of the hospital, I would say, hey, that's a good deal with this vaccine. With this virus.
Absolutely.
I think yeah, we definitely have similar experience, and based on what I've seen as well, we're doing some consulting work at Advent Health, seeing so many people, like 60% of those patients are COVID-19 patients. So, having this major impact, how the pandemic is impacting people, I really think that they should consider taking the vaccine.
If I can add to that, what we're starting to see, and Dr. Akujobi could probably chime in on this too, is that we're starting to see how it impacts younger people now. We're seeing a huge increase in younger people. I'm admitting more young people, and I say younger, under 50, who are having serious complications, from the COVID virus to this day, and so everyone should take it serious, but we're seeing the real impact of it. And I'm starting to see a younger and younger patient that's getting adverse effects from it. And so if you can get the Johnson & Johnson, I would absolutely do it.
So you were mentioning, Dr. Paige, you're seeing younger and younger. I mean, and Commissioner Burns, I don't know what you're hearing, but it seems, from the stories that we've been doing, that it's really sometimes the younger folks that don't want to get the COVID-19 vaccine for whatever reason. Maybe it's because they don't think that they will get seriously ill, but for folks who are under 50 who are listening to this, why? Dr. Akujobi, why should they get it? If they're healthy, if they're young, no pre-existing conditions, why?
Well, they should get the vaccine because I think it's the responsible thing to do. We all have family members who are, are older. We all have family members who are younger. And seeing that, vaccinations aren't currently available for people under the age of 16, we're all still at risk of, putting those children under 16 or exposing them or putting them at risk of getting COVID-19. And so I think the responsible thing to do, seeing that we're in a pandemic and we want to kind of move forward, is to get vaccinated. And I think the reasons why we're seeing more younger individuals testing positive for COVID-19 is because initially all of our efforts were for more of the most vulnerable populations, the individuals above 65, individuals with medical illnesses. Now that we've primarily gotten that population pretty much vaccinated decently, now it's the age group that kind of has taken on the notion of, choosing whether or not they want to get the vaccine or not. And so this is now why we're seeing more cases of the 30 to 40-year-olds that are young and healthy that want to kind of get back out and active. We're seeing cases of COVID-19 rising in this age group.
I want to get to, the effects of the vaccine, the side effects. But before I do that, I think you bring up such an important point, Dr. Akujobi. I think for all of us, we've been living with this pandemic for now more than a year now. So many people want to get back to that sense of normalcy. What role does getting the vaccine play in that for people to be able to resume life as normal? Does that help, and how beneficial is that?
It plays a huge role. I think, if we can get to the point where we have vaccinated a majority of the population, we get to this point of where we're at herd immunity, right? We can kind of get back to a little bit more of normalcy. Now, I think there will still be some time where individuals will have to be vaccinated. We're still kind of practicing social distancing measures. We're still wearing masks, right? But when we see the mortality rates go down from individuals dying from COVID-19, and we see case numbers also going down, then that kind of proves that, this vaccine is having a positive impact. And so we're moving in the right direction. I think now the issue is that, we kind of have to, kind of go out in the community and convince those that are a little hesitant about getting vaccinated that the importance of getting vaccinated.
I think part of the reason for hesitancy, and Commissioner Burns, maybe you can weigh on this, seems to be, gosh, well, what could happen to me after I get it? What are those potential side effects? Is that, Commissioner Burns, something that you're hearing about why people might be a little reluctant is side effects?
Yeah, I believe it is side effects, but also I think it's deeper than that. Again, going back to the historical mistrust that many of our, especially our African-American communities have. So I think that historical mistrust, with then seeing how you hear about it usually takes vaccines years to come to market, and then this was done within 12 months. So a lot of the uncertainty, but I go back to, that's why it's important that we are transparent and identify and engage our communities in these discussions, and not, don't, belittle them if they have some concerns. We need to answer their questions, engage them, because the more transparent we can be, the better and more accepting, I believe, of all communities will be of this vaccine, but any further health initiatives that we have moving forward.
Absolutely, transparency. And of course, if you don't have questions, everyone has questions. What's important is that they are answered in that transparent way. Absolutely. Dr. Cadet, speaking of potential side effects, if someone were to think, okay, should I get a vaccine? What could happen to me? What are some of those potential side effects for people?
Well, the most common side effect is swelling at the site of injection where you get the shot. You can get some swelling and some pain. Like I took my Pfizer vaccine, my first shot was in December 21st, and 5 hours later, I was like, whoa, I'm sore. So soreness. you can get that. That's the most common actually. And then other side effects, you can have headaches, malaise. You can get tired. My second shot in January 11th, I should remember that. I experienced some malaise, some fatigue the next day, but then the day after I was fine. So, but that's really a sign that your immune system is working. So those are some of the side effects that you can get from the Pfizer and Moderna. And by the way, Johnson and Johnson, one of the advantages of the Johnson and Johnson, those side effects are much less. The people that get fever, let's say you get fever at 60% or 70% from the Pfizer, but the Johnson and Johnson is like half of that, 35. So that's why that Johnson and Johnson was very attractive. One shot, being able to be refrigerated, but also the side effects are much less.
And so that means it's working, right? Side effects are actually maybe not a negative indication, but something that your immune system is reacting. Okay.
Right. In medicine, we call it reactogenicity, but for the layman, it's side effect, undesirable effect.
Okay, Dr. Paige, we keep talking about the condensed trials and research. We don't know really, I mean, gosh, the long-term effects, but Dr. Paige, can you talk to us, from your perspective about whether people should be concerned about long-term impacts of getting the vaccination, because perhaps there's hesitancy there because honestly, we don't fully know.
Yeah, I don't think long-term effects are really going to be a big concern. When you really look at, all of our vaccines, there are very few long-term effects that we get from our vaccine, but you get a huge benefit for a lifetime from some of them, right? And so you don't see a lot of long-term effects from vaccines. I'd be very surprised if you see a long-term effect from any of these vaccinations at all. It's just not very common. I mean, obviously there's some theories that vaccines can cause certain things in the pediatric population, but for the most part, you don't see any long-term effects from vaccinations of any kind. Typically, what you see from vaccinations, if you're going to have some type of response to it, it's typically going to be early on, and you'll know it, early on, especially like with the, we talked about the Johnson & Johnson, and we talked about the clots that form or what have you. Typically they say after 2 weeks, if that hasn't happened to you, you're probably fine, right? And so typically what you get from vaccinations, if you're going to have a reaction, it's going to be in the first couple of weeks, maybe first couple of months, but really not long term at all.
Okay, so a question that we've been getting a lot is, could the vaccine give me COVID-19? I feel like it's like the flu, like, oh gosh, I got the flu from the flu shot. That can't happen. But what about the COVID-19 vaccination? Dr. Paige, can people get COVID-19 from this vaccination?
Not at all. Not even a chance, 0% chance of getting COVID, because they aren't using a live virus. The technology they're using basically, and when you get injected, it goes into your body, and your body mounts a response, as Dr. Cadet said, and your immune system has a memory. And so what happens is that if you get the actual COVID infection after that, your body recognizes it, and then it basically destroys it and gets rid of it. So we're not using a live vaccine with these, right? Some vaccines are live, but this is not a live vaccine at all. So
they're not injecting you with a little bit of COVID-19 that's live. Like, that's not at all what is happening.
Not even close.
Okay.
I feel confident, and I'm sure everyone else will agree, 0% chance of getting COVID from these vaccinations.
Okay. I like that, 0% chance. Dr. Paige, you heard it straight from his mouth. All right. So Dr. Akujobi, there's another thing. One of the residents asked us, she actually had the coronavirus. She had COVID-19. She also had pneumonia. She's wondering now, well, if I have this immunity, do I really need the vaccine? And if I do, can I just get 1 shot versus 2 shots? So Dr. Akujobi, unfortunately, quite a few folks have contracted COVID-19. Should this population still get the vaccinations?
So yes, this population should still get vaccinated. So because COVID is such a novel vaccine, we're unsure once once you've caught COVID-19, how long your own internal immunity is going to last. Okay, and so studies have shown that it's probably best to still get vaccinated because we are unsure of how long that natural immunity from catching COVID-19 is going to last. And now, when it comes to getting vaccinated and speaking to immunity, this means that you need to complete your full vaccination course. It's not that after you get the first dose of Pfizer, you are at risk of catching COVID-19. Okay, so studies have shown that after you get your first dose of Pfizer, you're at an 80% chance of being able to be protected from COVID-19, but it's not until after you get your 2 doses of the Pfizer vaccine and still wait a total of 2 weeks is when your body kind of fully mounts that full immune response for you to be fully vaccinated. So individuals that have caught COVID-19, they can still and they should still get vaccinated. Initially, CDC was saying maybe they should wait about 90 days, but recently it's been saying, that they can kind of get it a little bit more earlier. But I think overall, the idea is that once you get vaccinated, you need to get both doses if you're getting the Pfizer or the Moderna, and your full immunity kind of isn't there until 2 weeks after your last dose.
Well, what if people are thinking, I only want to do 1 dose? It should be enough. I'm at 80%. I'm at 90%. Dr. Cadet, let me pose that question to you. What would you say to people who say, you know what, 1 is good enough when it comes to Pfizer and Moderna?
Right. So right before I answer that, let me go back a little bit with the getting COVID-19. What happened is when you get COVID-19, you generate antibodies, and not all antibodies are created equal. So that's what is called neutralizing antibodies, that the actual vaccine help you with those, developing those. And then once you get with the vaccine, you don't just make antibodies, but also you want to strengthen the whole immune system, the B cell and the T cell. So when you get sick with the COVID-19, you get that 1 shot, you actually can get that strong immune system where you activate your B and T cells. So when you get COVID-19, that's considered like your first shot. And then when you when you get vaccinated, then your second shot. So every vaccine works with you trickle the immune system and then you boost the immune system. So you would say that the being exposed to the natural COVID-19, your first, and then getting the vaccine, that's your second, theoretically. But if you want to get both doses, that's actually even better, because you actually it's all about strengthening the B and T cell, making them last longer in terms of protection.
Okay, so everyone really should just get that second shot, because that will
basically
only strengthen your immunity.
Right, the B and T cells.
Okay, so Dr. Paige, for folks listening who may not have had their COVID-19 vaccine and are now feeling a little more comfortable perhaps about it, but they still have a lot of questions. Is there anything, Dr. Paige, that people should do to prepare to get vaccinated? And what should they do after getting it? Is there pre-preparation? Is there, post-op?
Well, there's not really any pre-preparation. The pre-preparation is mental, right?
Okay.
You have to make the decision to go and go and get the shot. I think that's the biggest thing. Obviously, if you have active COVID, infection, you don't want to get, vaccinated at that time. You need to quarantine. But as far as preparing for it, you just have to mentally, get to the point where you accept, the fact that, you need to get it done and just really go and get it done, really. I think as far as after you get it, how do you prepare? How do you deal with that? As Dr. Cadet mentioned, some of the side effects that you do get, right? You just kind of treat those symptomatically. There's been a lot of discussion about if you should take medications before you get the vaccine,
right,
or take them after. It's not recommended that you take them before. I mean, we're not sure what the effect is, but probably not after. And I'll just give you my own personal story. When I got my second Pfizer vaccine, I think it's January 2nd or 3rd. And I went right home and I took some Motrin, and within an hour, and I was sore, right? So what you want to do afterwards is just kind of, drink a lot of fluids, all right? You want to make sure that you're hydrating, make sure that you're treating any symptoms. If you have nausea or vomiting, you need medications for that. Soreness, you can take pain medications for that. So like you would treat any other, situation where you feel like you have a virus or viral syndrome. But you also want to look out for any concerning symptoms, like if you are getting headaches, and they're lasting long, or if you're getting shortness of breath, you could be having a reaction. You start having wheezing, swelling of the lips, swelling of the tongue, swelling of the throat. You want to look out for those things. Those things are rare, and that's why we have people wait about 15 minutes, but obviously there can be a delayed response. But if you're just getting the typical malaise, fatigue, soreness, then you just treat those symptomatically, really, and just really look out for the more severe symptoms that you may get. And if you get those, seek medical help right away.
Dr. Paige, I have a question for you. I don't know if this actually works or not, but I was told after you receive a vaccine to like rub your arm really well to distribute the medicine. Is that hooey, or is there actually some sort of like medical, I don't know, intellect behind that?
I don't know that it makes a difference at all.
Okay.
Really. I mean, it may make you feel better about it, but it's going to get into your system no matter what, right?
Okay.
What we do recommend if you are sore is to really work really work that shoulder, move it, so, and that actually helps, keep it loose, and helps that muscle loosen up. But I'm not sure if rubbing it really makes a difference at all, because it's going to do what it's going to do. It's
okay.
Get in the system just fine without you doing anything to it, really.
Okay. Good to know. I did rub my arm after my first shot and I felt like it worked. But you know what? It's mental, right? Probably whatever works makes you feel better. Dr. Akujobi, you mentioned kind of 2 weeks after. So for people who are like, you know what, I took my vaccine, I'm going to live my life, things are going to be great. How much time, though, realistically, does it take for your body to fully build up that immunity against COVID-19?
For that question, I'm just going to lean on the CDC's recommendation, and that's to wait the 2 weeks, because, we have seen a small number of cases of individuals that have caught COVID-19 after their first dose. And so I think that, maybe they kind of were a little bit more lax with their, mask wearing or their social distancing, but I would definitely kind of more or less lean on the CDC's recommendation of waiting the full 2 weeks after your last dose. And when it comes to the Johnson & Johnson dose, it'll be waiting the full 2 weeks after your first Johnson & Johnson dose.
So, you know what, I have another question for you. You'd mentioned wearing your mask and social distancing. When you're thinking long-term, thinking, okay, I want to get back to my new normal. If I were to take my COVID-19 vaccine, do I have to still wear my mask? Do I have to social distance? I want to pose that question to the panel, for folks out there as they prepare. I mean, is that necessary anymore if you get your vaccine?
Absolutely. Because when you look at the efficacy, it doesn't say 100%.
Right, right. I agree.
And so we've seen some recent data where they talked about, I guess we were at 66 million people that had been fully vaccinated, and there were still about 5,800 that caught COVID. And there was a smaller number, like 74, I think it was 75, that actually ended up dying from COVID, right? So it's not 100%. So you still have to, use the same precautions that you were, having before. But CDC has loosened some of the, has put out some guidelines where if you're around other vaccinated people and indoors, things of that nature, if you're outdoors, but for the most part, I think you should, if you're out and about, all right, and you're out, that you should still social distance. You should wear your mask, because as Dr. Akujobi has said, we've seen people, I haven't seen anybody that's gotten it after, but obviously the data shows that it happens. But obviously we see people in between, vaccinations who actually get it. I took care of a gentleman about a week and a half ago who had Johnson & Johnson shot, and he caught COVID he came in about 2 weeks after getting the shot, and he had COVID, right? Because he was he was still in that window, and he was actually COVID positive. But you still have to be careful. You know, it's not 100%.
Dr. Akujobi, I just got an alert that we need to let you go. You have your very important 12-hour shift coming up at Orlando Health. So thank you so much for your time. Before you do need to run off to get to your actual job, is there anything else that you would like to just share with folks out there?
I would just say thank you guys so much for having me on this panel. I think that we are moving in the right direction as a society as we're combating COVID-19. Vaccinations are a key and a huge component of those efforts in combination with social distancing and mask wearing. So I will just say I have full confidence in the current vaccines that are available, the Pfizer, the Moderna, and very soon to be Johnson & Johnson again. And so I just recommend, you know, especially individuals that are coming from underserved communities that have a little bit of distrust to, you know, rest assured that this is in your best interest to be vaccinated. But overall, thank you guys so much for having me tonight. Best of luck on finishing it out. But thank you guys.
All right, thank you so much. That was Dr. Akujobi, who is an emergency medicine physician at Orlando Health. Best of luck on your shift tonight. All right. Okay, so we are going to continue our panel, though, because there's just still so much information left. You know, I think that was so interesting, Dr. Paige, that you were saying that there was a gentleman who actually contracted COVID-19 after that second shot. So people just still need to be careful, bottom line.
Absolutely, no doubt about it. You know, because you never, the thing I speak to people about all the time is that you never know how COVID is going to impact you personally. You know, physically, medically, or what have you, right? So it's really not a virus that should be taken lightly. I can say, you know, I've been practicing over 20 years, and I really haven't seen a virus such as this. And there's still a lot we don't know, and a lot that we're still learning, you know, about the virus. But until we can get, you know, as Dr. Akujobi mentioned, until we can get to levels where we do have 70, 80% of people vaccinated, and we can kind of start getting to that, you know, herd immunity, you know, because you're never going to get 100% of people vaccinated. It's just not going to happen. But the more you get vaccinated, you know, the less likely you're going to see the variants, you know. I mean, that'll cut down on the variants, which we know we're seeing a lot of those now also. You know, so I think it's important to be cautious, you know, as if you were. I still act like, you know, I still do the same things I did 6 months ago, you know, when I'm out and about, you know, wearing a mask, you know, make sure I'm social distancing, but I feel a little more confident about being out, right? Because I do have the vaccine, and it makes me feel a little bit better about maybe going to dinner, you know, and doing those type of things.
So I'm curious, because we've been talking this whole time about people getting the vaccine. Dr. Cadet, I'm curious though, are there people who should not get the vaccine?
Well, most people actually qualify to get the vaccine. There are a few instances where you should not get the vaccine. For example, if you had a severe allergic reaction to the first dose, or to a previous vaccine, Pfizer or Moderna, you should not get the second dose if you had severe allergic reaction. Now, there are what is called relative contraindication, that if you have a severe allergic reaction with another vaccine, like the flu shot or another vaccine, then you need to be observed longer. But for the most people are actually qualified. Even immunocompromised people, you may not react as well as immunocompetent people, meaning that if your immune system is strong, but you can still take the vaccine. So most people actually take the vaccine.
Well, what about children, Dr. Paige? I know that there have been trials with children who are younger and younger, but for families out there who are wondering, well, is it safe for my kid? What would you share to them?
Well, I think some of the early data, they are doing trials now on the pediatric population. You know, now it's approved for 16 and above, but there are trials being done on the pediatric population, and so far it's shown to be pretty effective. and pretty safe in the pediatric population. And I would think probably in the next few weeks, we're probably going to be looking at Pfizer. I know at least Pfizer is doing it, and maybe even Moderna at some point in time asking for emergency authorization to actually use it in pediatrics. I think down to at least age 12, I think is what they have been studying, and so it's shown to be pretty safe and pretty effective in pediatrics. So I would assume before summertime we'll probably have some type of emergency authorization approved by the FDA.
What about women who are pregnant or who are looking to get pregnant? You know, obviously you're not just concerned about yourself, but perhaps your unborn child or soon to be unborn child. I mean, what would you share to women who are either pregnant or hoping to become pregnant? Should they get the vaccine?
Right. I think that also they're doing studies in the pregnant and in that subset of patients, and I think it's shown to be safe. And that in pregnancy and in young women, and that's some of the hesitation we're seeing also in women of reproductive age, hesitant to get the vaccine because they do have that concern. So there are some studies, and again, just like the pediatric population, I think that they are seeing that it is very efficacious, and there are really no really negative effects in actually administering the vaccine in pregnancy.
Okay, what about accessibility? I'm curious, Commissioner Burns, I know that you're going to have a mobile vaccination distribution tomorrow, but when you were talking with folks, is that, an issue as well? There's hesitancy, of course, but then it's hard to actually get the vaccine in certain areas. Is that what you've been hearing?
Yes, definitely, especially in the early days of the vaccine when we were prioritizing our seniors because it was, vaccines weren't as accessible on the west side of Orlando, but also many of our seniors were required to go online, register, make appointments and things of that nature. So there were some barriers, but I'm encouraged because since that time, we have more of what I'm calling, pop-up vaccine clinics. Here at Orange Blossom Family Health, we're doing pop-up vaccines every week, several times a week. We just had one at Jones High School where we vaccinated 35 students. And so we're doing things like that, going into our seniors' homes, identifying individuals who are homebound, going to their homes and administering the shots. So I'm encouraged. The state has been rolling out these pop-up events, and like the one that will be happening at Mount Pleasant Missionary Baptist Church on tomorrow from 10 to 6. So again, we have to continue to make those vaccines accessible, ensure that we're going to the areas where these hard to reach communities are, but also that we're taking the time to educate them and hear from them of, what will it take for them to get the vaccine? Because I think we're in a unique position right now through this COVID-19 engagement with the healthcare system. I think we're in a unique opportunity to establish some trust with some of our minority communities and our healthcare providers and our health institutions. So we can start to, when we get past COVID, we still have a lot of health disparities that plague many minority communities. So we're hoping through this COVID, we will connect them with a primary care provider so we can establish that relationship so we can continue to move them to living healthier lives. But fortunate that some of this engagement is coming through COVID-19, but we still need to push for equitable distribution of the vaccines. We just can't go to these underserved communities one time and check it off. We have to continually go back because the person who is hesitant today may be confident tomorrow. So we have to make sure that we're coming back and giving them that opportunity to get vaccinated. So we must remove all barriers, engage all communities, because again, it's going to take all of us to do our part to end this pandemic.
Have you felt, through this year or so, have you felt that trust being built? Have you seen that? Have you heard that from folks who were, at the very beginning of the pandemic? And there was a lot of mistrust and uncertainty, especially like you had mentioned with the historical significance of the medical field not being transparent.
Right.
Especially with the African American community. Have you felt that trust being built through your efforts, through others' efforts?
I think we are seeing some of that trust being built, because now what's happening is we're getting calls every day asking for appointments to get the vaccine, where in the beginning we were doing a lot of outreach. I actually went door to door in my district to let people know that the vaccine was available at the Walmarts and encourage them to get vaccinated. But now what I see is individuals contacting me, and it's fortunate. And I think we have to also recognize that there are key individuals within our communities, elected officials, pastors, doctors, who, if they are saying you should get vaccinated, oftentimes people will take that into consideration. So I oftentimes give my cell phone to individuals who I run into, and they're hesitant. I say, well, when you're ready, just give me a call. And so, but you also have to be able to deliver on that. So when they call me, we're able to get them in that day or the next day for their vaccine. So I do think that there's been some improvement in that trust, because I believe people are seeking out that information. Because again, when you look at the impact that COVID-19 has had, a lot of people are stepping back and saying, wow, this could be me. But also what I'm seeing is individuals are adopting healthier lifestyles as well. So again, I think there will be some good coming out of this COVID-19, but first we have to get out of it.
Absolutely. So Dr. Cadet, I mean, what are your thoughts on that? When you interact with your patients, what are the discussions that you have when it comes to getting the vaccine?
Well, at first, there was some hesitancy, although I'm not getting this. And then as we do more education and we explain to them the safety and effectiveness, and we even tell them, look, you have other minority scientists who actually participate in the research, like for example, Cobit, the African American scientist advocate and participate in the Moderna trial. So that's reassuring. I also share with them my own experience, how I took the vaccine early on, and also my mother and my wife, for example, getting it. No, God, oh, your family getting it? I'm getting it. So it's really the building the trust. But I also do, I try to go out there myself to give the vaccine. For example, I started the years of vaccine, and I was going from the most hesitant people, and they told me, you know what? I wouldn't get it if you didn't give it to me because I don't trust nobody else. So I'm like, oh, well, but that's good. So that I realized that we need to be more aggressive, more engaged in terms of reaching out to the community.
Dr. Paige, Dr. Cadet mentioned almost like humanizing and personalizing COVID-19 vaccines for you. Is that, have you seen that, just, it's not just a medical, kind of a medical issue, it's a human issue, Dr. Paige? Is that something that you've been seeing? Because Dr. Cadet, mentioned that so eloquently.
Absolutely. I think what you're seeing is that, is that, I call it the copycat, as you see, those around you getting vaccinated, other family members getting vaccinated, friends getting vaccinated, and now you start to become you start to accept it a little bit more, feel a little more comfortable with actually getting vaccinated. And if I can add on to that, it's something that Commissioner Burns mentioned, is that really going out into the community, and I think that I think he's done a wonderful job in District 6. But one of the things we have now is we have a great federal support. The federal response is making this vaccine so available, right, that there's really no excuse that you can't really get the vaccine, to be honest, right? And Commissioner Burns and I talked about this multiple times, months and months ago, is how do we get people educated, on the vaccine and the benefits just for the community, whatever community you actually live in. But I do think as you see people, around your community getting it done, the neighbors and, cousins and uncles, I think that is what is kind of help break through some of those barriers that maybe someone had that did not want to get the vaccine. I tell people, I have people laughing all the time, is that I had people in my own household that didn't want to get the vaccine, no matter how many times I told them they needed it, right? Even after I was vaccinated. And then what ends up happening, they hear a friend got it, all their friends have it, but they don't, and now it's like, okay, well, let me go ahead and get it. So I think that's a very real dynamic out there, to be honest.
Right, because it's become more normalized. I'm curious, do you think that this is just going to be, we get the flu vaccine, the kids get the chicken pox and the measles. I mean, is the COVID-19 vaccine going to be part of our annual vaccination list? I mean, is that what we're thinking?
You asked me, unknown.
Okay, unknown.
I think that I'll give you my opinion, because I don't think anybody can really tell you, the true answer to that. But it would not surprise me if we now have to get a flu shot and a COVID shot, every year. It wouldn't surprise me, but we've had pandemics before, and those viruses end up dying off, and we didn't have to deal with them years later. But there's something about this virus that's so tricky, right? And we don't understand enough about it. So I wouldn't be surprised if we have to get these booster shots. We hear in the news about the booster shot, and we may get to the point where you might need an annual COVID shot, along with your flu shot, and so I would not be surprised, but I don't think anybody knows the real answer to that question until we can get everyone vaccinated, and kind of move beyond where we are now.
Well, you had mentioned, Dr. Paige, the booster shot. So Dr. Cadet, Pfizer at least has said that people might need a booster shot anywhere between 6 months to a year after their second dose. Why would that be? I mean, if we're talking about 2 doses, then why are they talking about a booster shot?
Right. So we have multiple strands of the virus. I just can't remember those numbers, but you have the African strand, the Brazilian strand, the Californian strand, all kind of strand. So thankfully now, the Pfizer vaccine seems to work, but eventually with so much resistance, we might end up needing a booster in order to meet the effectiveness of the vaccine.
If I could comment on that really quick, the way the way these vaccines are actually developed is that you can change the actual process of developing a virus, the genetic makeup of it, to actually work better against these new strains. Once you figure out what the strand is, you can then go in and adjust it. Pfizer can go in and adjust the vaccine to be more effective against those strands. And so that may be another reason why we may be looking at getting booster shots as we look at all the different strands coming from all over the world. They have multiple names, as Dr. Cadet mentioned, but that is I think the neat thing about the way these vaccines are manufactured is that Pfizer could probably go in and probably in a couple of weeks to months, okay, we have this South African variant, we have that covered for sure. Now we're not sure if it covers it, but they can go in and kind of change the manufacturing process, because we're not sure how these vaccines help us against the variants. But I would say one thing we do know is that having the vaccine, you're going to do better against a variant than not having it. You see what I'm saying? So that's the most important thing.
Any protection is better than no protection.
Absolutely.
Yeah. Okay. I know that it's 6 o'clock and we're going to have to wrap things up. We could talk about this for hours. It's fascinating. It is insightful. It is informative. Dr. Cadet, let's start with you. Is there anything else before we kind of wrap up this forum? Anything else that you would want to share with folks out there when it comes to the safety of the vaccine, the side effects, why people should get it, address hesitancy, any last thoughts that you might have?
All right. What I want to say to my brothers and sisters is that we're still in the middle of the pandemic. I mean, we have so many cases, about 70,000 cases a day. So we're still in the middle of it. And one of the best ways to get out of it is through the vaccine. You can have the public health measures in terms of wearing masks, social distance. You cannot do those things forever. So in order to get out, you need to be vaccinated. And we have 3 vaccines that are under the emergency use authorization that are effective and safe. And believe me, when I say safe, I've read the data, I've made a decision in terms of getting it and also encouraging other people to get it. So those are safe and effective. You don't want to fall behind. And some people say, well, we don't want to be used as guinea pig. Guess what? You're gonna be left behind because you have so many people being vaccinated. So I encourage you, I implore you to get vaccinated. You can get out of this pandemic so we can move on with our lives, so we can go back to church to worship, so we can go back to school, all of the kids go back to school without having to worry about getting COVID-19. That's my message to the brothers and sisters.
And Dr. Paige.
Right. I mean, he was very, very eloquent, you know, in what he said, and I totally agree with everything you said. And I would first let me thank you for moderating this, and thank Commissioner Burns for putting together, and thank him for his outreach in the community as far as this goes. But I think that, you know, we need to encourage everyone to get it. Everyone should get the vaccine, but everyone that gets vaccinated should become a champion for vaccinations, you know. And I think that's how we're going to get through this, is to really become a champion. If you believe in it and you've done it, go out and tell the world also about it, because it's, you know, we can scream from, you know, the mountaintop and we can do all of that, but, you know, it's not until, like you talked about, you know, the personal touch, you know what I'm saying, the personal approach. And I think that's what I would say is that, you know, if get vaccinated and then become a champion of the vaccines, and just encourage your loved ones, you know, even if you have to, you know, make them feel guilty about not doing it, you know, it may at some point in time save their life. And this is truly, I would truly look at this as a life or death decision, to be honest. You know,
Commissioner Burns, yes, absolutely. You spearheaded this event. Any last thoughts?
Yes, first, I'd like to say thank you, Stephanie, for the great job that you did in moderating, and thank you to Channel 13 for allowing you to do this, and thank you to our panel. Dr. Akujobi had to leave us, but thank you to him and Orlando Health. Dr. Kirk Cadet, my colleague, my Chief Medical Officer at the Health Center, thank you. Then also thank you to Dr. Ernest Paige, my older cousin. So we have a lot of connection. Also, Stephanie, I just wanted to deviate a little bit and share with you a connection. The 3 remaining panelists are proud graduates of Jones High School.
Oh, I love that.
So Jones High School making a difference. 2 positions, 1 administrator. Yeah, there we go. There we go. So we're proud to represent the great Jones High School, but also very proud to be in the positions that we are to serve a community that means so much to us. So I just like to thank you to the panel. And then I want to just ask everyone to please do your part in ending the pandemic. If you've already been vaccinated, please encourage, and as Dr. Paige said, be a champion for the vaccine. But also do your part, because it's going to take all of us. And then I'd just like to share information on 2 vaccine events that are happening. One that's happening tomorrow at the Mount Pleasant Missionary Baptist Church in District 6. It's a mobile vaccine event from 10 a.m. to 6 p.m. at 4407 Prince Hall Boulevard. No appointment is needed. You can just you can drive up. Also, this weekend at Orange Blossom Family Health in Ivy Lane at the Ivy Lane Health Center, over in Commissioner Regina Hill, who's also been a true advocate and a champion with getting the word out about the vaccine. So we'll be doing an event at Ivy Lane Health Center in her district, and that will start at 10 o'clock from 10 to 2 on this coming Saturday. So also, as Dr. Paige said earlier, there's no reason why you shouldn't get vaccinated, because their vaccines are much more accessible now. So again, I just ask everyone to do their part so that we can end this vaccine, so we can start to travel, embrace our loved ones again, and then just enjoy, you know, life and enjoy each other. So again, thank you, Stephanie. And I wish everyone a safe and happy evening.
Thank you. Thank you, Stephanie.